I'm Michael Kundi. I'm head of the Institute of Environmental Health at the Medical University of Vienna. I started to work in the area of electromagnetic fields in the mid of the 1980s, so it's almost 30 years of studying at the level of single patients, but also at the epidemiological and the experimental level. We studied the effects of electromagnetic fields in animal, in tissues, in humans, experimentally as well as in epidemiological studies. And my first experimental study was near a shortwave transmitter station, and we found a clear increase of genotoxic effects as the exposure increased, and this was in contrast to the belief at the time that there could be no genotoxic effects from these exposures due to the low level of the photon energy. But it has been shown also in additional investigations that these effects are real.
Electrosensitivity, what do you believe in, what should government and citizens do?
Well, the issue of electrosensitivity is complex because there are different symptoms, there are different personal experiences of these people, but I believe that there is a large proportion of individuals where the sensitivity was due to an exposure, and this relationship is a real relationship, but the differential diagnosis between those that have only an attribution to electromagnetic fields but without actual induction of the symptoms due to the exposure and those with real relationship is very difficult. Maybe we have diagnostic markers in the future, but right now the situation is very complicated.
Many people say it's the fear of microwaves, but what percentage of people with EHS did not know there may be a risk, were not aware there being exposed?
Yeah, I think that the majority of people with electrohypersensitivity don't even knew at first that they were exposed to electromagnetic fields. So I don't think that fear about exposure is the source of the symptoms. It might contribute later to the persistence of symptoms, but the original symptoms have, in many cases, arise without knowledge of the people about the exposure.
And what are the best treatments?
I think that it is difficult to say a general word about therapy. It has to be assigned to the individual, but antioxidant activity is a good starting point. Also, balancing of vitamins is of importance. So, in general, healthy living. I think that we are still far away from causal therapy.
And how much does avoidance help?
Of electromagnetic fields? I think that they have already developed a habit of avoidance. This need not be part of the therapy because many of the patients I know, they cannot bear an environment with high levels of EMF exposure. So the avoidance of the exposure is one of their own therapies.
Okay. finally, what should public health officials do? Government?
I think that there are some preventive measures that are easily taken. We have spoken today about the installation of Wi-Fi in schools. There are alternative technologies. I don't speak of wired Wi-Fi, but of other technologies that don't carry the risk of overexposure with respect to electromagnetic fields and microwaves. So there are technical solutions, but they will not be implemented if we carry on just with the concept that if we avoid heating, then we have no problem. So the first step is recognizing non-thermal effect as a real effect. And this hasn't happened in the scientific community to the degree that is necessary.
Where is the hope for the patients?
Pardon?
Is there hope for change?
I think so. I think there is some hope. There is a renewed strength in the scientific community to study electrohypersensitivity seriously. That is from mechanistic, from diagnostic and therapeutic standpoints. And the evidence is increasing that there might be a future for specific diagnostic markers.
Okay. Thank you very much.
Thank you.